talking to Dr. Janine Bycroft today, and she is the founder and director of Health Navigator. What does it look like on the website?
So on the website it's got a homepage, and what we do is aim to provide a summary of key information. So there's a slider, and then there's different tiles, and we change those every week where we're updating new topics as they come through. And then along the top there's a nice easy navigation, so people should be able to find their way pretty easily. But yeah, we really, the thing that got us started was looking for, there were just so many hundreds of websites that as a GP we might need, or as a clinician might need in a week, and the fact that it was really hard to know where the best information was. So the website has thousands of pages, and it's got main categories as health topics, so health A to Z. So one example was gout. There were so many different booklets for gout for consumers, and how did you know where the best one was? Was it on the Pharmac website? Was it on the Ministry of Health website? And had they been translated into different languages? So we also have a section of a video library and languages section, and that's really popular too, because some of the DHBs have created great resources and translated them, and other areas around the country will have no idea they exist. So we're trying to bring it all together into one sort of digital front door. And then the medicines is a big section that's really become increasingly popular as people are looking for plain English information around medicines. So that's now our second biggest area in terms of visits to the website. And then we have a section on healthy living, so exercise, nutrition, alcohol, stress, sleep. Sleep pages are popular. And then there's also sections for clinicians. So there's an area with continuing professional development, links to pathways. We've started a section for students on clinical skills.
Oh, cool.
Yeah, and that would actually also be relevant for registrars. So they can refresh ECG skills or reading x-rays or all sorts of things. So we know a few med students that are helping us to sort of build up that section, so that's been really useful. And then also when there's conferences, we'll often link to presentations if they've been made available online. So yeah, there's a really broad range.
Cool. Tell us about the app library.
Okay, great. So the New Zealand Health App Library is something that we started about 3 years ago. And it evolved after recognising there were so many apps out there, but as an individual clinician I had no idea which was a reliable or useful app to recommend to patients or clients. So we thought, look, surely there's a way that we could develop some criteria to assess them, and then work with other GPs and clinicians to review which are the best ones in each different category. So that's sort of how the app library got started.
Sure. So who do you have reviewing, and how do you decide what the criteria are?
So developing the criteria was a really long process. We obviously did a literature review and looked at what was happening elsewhere around the country and around the world, and then with an advisory group we over a year worked out what the criteria were going to be, and kept refining the process. So now we've got it down to quite a clear number of levels that we review. So we do a formal review using what's known as the MARS tool, which is a mobile application sort of review score, which is used in a lot of research studies. And so two independent people review it and then compare their scores. Then we do a clinician review, so we get a clinician to look at it from ideally a specialist if it's a rheumatology, or a GP if it's pregnancy apps, then a midwife, so someone who's got that expertise in the area to tell us, look, is this relevant, is this clinically safe, is it based on sort of best practice, and then where we can we try to get user reviews, so actually getting clients or consumers. Don't always get enough of those because finding the right people to do that. And then we also look at the relevance for New Zealand, because a lot of apps are American or English based and might not actually be that useful for New Zealanders. So and then we put that all together and give it an overall score in different categories.
And do you use, like, I know that if I go into the App Store there's review processes on there, so do you go and look at the ones that are have got higher reviews to start with, or how do you do it?
So for our selection process we start off with apps that have been recommended to us from other clinicians or clinical networks. We're also always looking at the literature, so we're looking for reviews that have been done around different categories. So if they've done all the legwork, then we'd rather build on that rather than starting from scratch. So we we have a steady stream of ones that are recommended to us. If they're recommended from someone who we think is just promoting their product, then we're not interested.
Okay.
So yeah, we have a flow chart that we follow in terms of our selection process. Yeah.
And so if any clinicians had an app that they thought that you should be looking at, you'd welcome them.
They're welcome to contact us,
Yeah,
and then we put it through our filter.
Yeah, very good. Okay. Well, thank you for chatting to us about that.